So good afternoon, everyone. It's a pleasure to have all of you here this afternoon for our April session of Latin American DOHaD webinars. And before I introduce to you our guest for this afternoon, I'd like to remind you to fill out the form to registrate your presence if you want to receive a certificate for this season at the end of this year. So please scan this QR code you can see in the screen so you can fill out the form and registrate your presence. For this afternoon, all of us in Latin American DOHaD chapter have a pleasure and are glad to introduce to you Dr. Yeneir Vera Fernandez. Dr. Vera is a cardiologist with experience in family medicine and population health. She has a master in child well-being and has focused on the impact of early human development in health lifestyles trajectories. She graduated as a medical doctor and cardiologist specialist in Cuba and have been working in Canada as a medical researcher for more than 10 years. Previously, at the University of Toronto, she was working as a research associate at Fraser Mustard Institute for the Human Development. She's currently working at the Alliance for Human Development at Sinai Health System in Toronto. She is the leader of the collaborative research initiative between the Alliance for Human Development and the University of Medical Sciences of Havana, Cuba, building bridges to the better health, and coordinates different research projects with the Cuban Ministry of Health and the University of Medical Sciences. Dr. Vera is interested in the origin and development of health and chronic diseases theories. Her research goals are focused on the impact of early life in adult and which interventions and policies are effective in optimizing individuals' changes of development, their full potential. Also, how to optimally communicate this knowledge to stakeholders, future parents, professionals, and policymakers. So, Vera, my dear friend, it's a very pleasure to have you here. The word is yours. Be welcome.
Thank you so much. For us, it's really a great pleasure to be part of DOHaD Latin American chapter, and at the same time to give this presentation to all of you. I will start because for sure in the future you will have a lot of questions. Thank you so much for this introduction. And as I said, it's a pleasure for the first time in Cuba will be part of this webinar series and DOHaD Latin America. So it's a great pleasure for us. So today, I will talk a little bit and very quickly about the collaboration with Cuba and Canada in terms of DOHaD theories. So in 2015, we started this collaboration between Cuba and the Alliance for Human Development. At the beginning was Fraser Mustard Institute for Human Development, and after was Alliance for Human Development. We have been working very close to with the national growth on human development in Cuba, of course, with the support from the Ministry of Health and different scientific societies. The main goal of this collaboration are the research projects, but also we have events, symposiums, and training sessions. And this allowed us, of course, to join forces in these research topics that, Cubans and Canadians were really interested. So I know that for Latin America, Cuba is a big, maybe a question about the health system. I just want to, before I start talking about the Cuban National Child Cohort Study, I just want to mention that the health system in Cuba is based on primary health system. So we focus on primary health care, promotion, and prevention of health. So for us, it's really important to understand the origin and development of chronic diseases. In Cuba, the main causes of death are chronic diseases, cardiovascular diseases, tumors, metabolic diseases. So for us, it's really important to, of course, target these diseases in the future to prevent the impact in adulthood. The infant mortality rate in Cuba is, as probably you know, is very low. Cuba has a lot of programs to prevent infectious diseases in kids, adolescents, but at the same time, we have a lot of work to do in terms of chronic diseases. So first of all, I talk about the collaboration with Canada. In the second point of my lecture, I want to emphasize that we are creating right now a DOHaD Cuban group. Is in process right now. So we propose that this group will come from the Internal Medical Society, and we will call different scientific societies to be part of the Cuban DOHaD group. So very soon you will have more information about it. Some of these members and the steering committee joined this conference today, so I can introduce, Marcos, in the future, all of them to you. So today I will talk about the Cuban National Child Cohort Study. And this is really exciting and interesting for us because in 1973, Cuba initiated the recruitment of more than 4,000 births from across the country. It was at the national level. So detailed questionnaires were collected on mothers and babies the first week of March in 1973, and they were followed during 17 years. So they collect information at birth, at 7 months, at 7 years, at 11 years, and 17 years. This was a huge study. It was led by the Growth and Human Development Group. And in this study, the main purpose was to have more information about children and adolescents in Cuba and report all of this to the Ministry of Health. This study was supervised by Neville Botter and Harvey Goldstein from England, and they were the authors from birth to 7. So they received, the Cuban team received the expertise of these important researchers, and also Robert Usher from Canada visited Cuba many times to give some feedback and expertise to the Cuban team as well. One of the leaders of this study at that time, of course, everything was led by the National Growth and Human Development Group in Cuba, and they collect amount of information that you can imagine from 1973 to 17 years. For example, prenatal information, they had all the information about, for example, general information, socioeconomic variables, toxic habits, previous medical history, also physical examination and lab tests. Everything was collected from the prenatal period, and after they collect perinatal information at the time of delivery. All the details, even information about breastfeeding, complications during the first week, immunization, etc. Why this is so important for us, or at that time in 1973, Cuba wanted to know more about all of these periods of time. That is why they followed these babies to 7 months and after 7 years. And they include more questionnaires about physical examination, general questionnaires, and also parents' questionnaires. So they have information about even living conditions because they were visiting homes, and the previous medical history and educational history of all of these babies and parents. At 7 years, they include the educational questionnaires with information from the school. They practice tests, math tests, logic tests, language tests, and more general information. So the information that we have is amazing because imagine from birth to 17 years, the amount of information that the National Growth and Human Development Group has is unbelievable. It's like a gold mine for any researcher because they have all of this population followed because, all of these years, and we have biologic information, educational information, home living conditions, etc. The methodology of this study was really well thought, and as I said, they received advice and expertise from researchers not just from Cuba, but even from Canada and England. So, why this is so interesting for us? Because as researchers and based on DOHaD theories, we thought, okay, we have all of this information from 1973. Cuba has, as you can see in this slide, all of these reports because they don't have international publications, but we have all of this report from every cohort that they did from birth to 17 years. So what about the adults right now? Where are these adults and what kind of information we can get from them? Because if we are analyzing the origin and development of chronic diseases, if we want to know, the current nutritional and health situation of all of these cohort participants from birth to now, these people in 2023, they will turn 50 years. So we will have 50 years of information of everything around these adults. So there are really few studies all over the world with this kind of database and this kind of information that we can analyze. So what are the goals of this cohort that we are proposing right now? We have all of this information on paper. So we want to find these adults right now, characterize the current nutritional and health situation of these participants starting in Havana City, characterize the social and economic situation of this population, and identify the relationship between the characteristics of pre- and postnatal growth, changes in living condition, nutritional and health status of all this population that we started studying in 1973. So all of you are very related to DOHaD theories, and in Cuba is something that researchers were focused on different projects, but right now I think that they are even more interested in these topics because before we always know that smoking, diet, lack of physical activities increase the likelihood of cardiovascular diseases. But research has shown that people who were light or small at birth run an increased risk of developing cardiovascular diseases. Also, suboptimal growth in utero may therefore play a role in the origin of cardiometabolic diseases in later life. So as a cardiologist, as a physician, it doesn't matter if you are just focused on risk factors. We need to know more. We need to know the origin of these diseases. We need to know how the environment, how during pregnancy this woman was affected, how this is transgenerational from one generation to the other one, and how we can target these factors and how we can improve the health of these children, and of course they can reach their full potential. So this is an amazing field, and I think that Cuba, that is so focused on the prevention and promotion of health, we need to know more about that. So this national study can allow us to know a little bit more about this. For example, the other thing that we know is that during pregnancy, if the nutrition is not good, so the babies didn't have inadequate nutrient supply. So maybe this led to permanent alterations to the structure or function of developing organs. So cardiometabolic diseases can show up during adulthood if we don't treat these diseases during pregnancy. So this is the motivation. So we plan to have this study in 3 stages. The first stage will be to put all of this information into a database. As I said before, believe it or not, all of this information is on paper. It's information from 1973. So the first step will be to put this information into the database. Of course, we need to write the proposal and have all the permission from the Ministry of Health, because in Cuba, as in any other country, all the research proposals, of course, we have to apply for the ethics committee, the support and the permissions from the Ministry of Health. So the first stage will be all of these, and participants will be contacted first in Havana City to follow up with questionnaires, physical examination, blood test, and electrocardiogram as a second stage. We are planning to do this second stage at the polyclinics. The polyclinics in Cuba are like a family community centers, and we have family physician offices who belong to these polyclinics. For example, every polyclinics can have approximately 30, 40 medical offices. So we can do this second stage at the polyclinics, finding adults from this study and applying the questionnaires, doing the physical examination and the main blood test and electrocardiogram. As a third stage, because we are planning that this study can be, huge, so we can divide it in 3 years, more or less. So after we can do more tests in the secondary level of attention, in the hospitals and cardiovascular institute, endocrinology institute. Maybe we can do echocardiogram, carotid intima media thickness examination, calcium score, stress test, and different examinations, more advanced, to know more about the chronic diseases. This will be the third stage. All of this study, we are planning to do it in collaboration with Canada as part of this collaboration that we already have. And the definition of the universe of a study, imagine we have a sample in the country for more than 4,000 patients. In Havana, we are expecting a sample between 700 to 1,000. We want to start first with like a pilot study in one municipality, and after we can extend in Havana City, and after we can extend in the whole country. The inclusion criteria for this study will be all the patients who were part in the national cohort in the first week of March in 1973. And the exclusion criteria for the study, of course, will be patients with severe illness that don't allow them to participate in the study, or of course, if they don't sign the informed consent for the study. This is our plans. And of course, we will have a lot of variables, information, general information, socioeconomic variables, psychological variables, and this part is really important because in the past research projects that we had with Cuba, the mental component, the mental health component was not very important. And in the last years, I think that we had to pay attention to these kind of diseases. It's not just psychiatric diseases, but also mood disorders like anxiety and depression, and how this can be correlated with the preconceptional and pregnancy period and perinatal period, because this can affect everything, including, for example, breastfeeding, postpartum depression. So all of these topics are really interesting to us because they can affect the children, the babies, and of course, in adulthood, can impact the health of the general population. So we are planning to have in the questionnaires all the general information, the socioeconomic variables, and the psychological variables. Also, we will do the physical examination. We will have as much as we can blood samples, mainly fasting glucose and lipid profile for now. And after, we will go deeply trying to find cardiovascular disease and metabolic diseases. This is the general plan. And we are planning, of course, to do this, as I said before, in collaboration with Canada. Will be an international collaboration, but at the same time, we are expecting to do this project in the way that different institutions in Cuba can participate, not just the polyclinics, but also the Endocrinology Institute, Cardiovascular Institute, Genetic Institute. Hermanos Almeida Hospital is one of the most important hospitals in Havana. And we are planning that maybe this project can be in 3 years. But I think that the amazing thing of this project is that we are creating, or we can create, an amazing database, and we can correlate the information from the prenatal period, pregnancy and perinatal period, and all of these years that the National Growth and Human Development Group followed these babies. And we can analyze the situation of these adults right now. So the origin and development of chronic diseases. So for us, this will be great. At the same time, we think that the patients can receive benefits with this study because we will know more about their situation of health. So we are really excited with this project. We have a lot of results from the 1973 cohort that we are already analyzing. This is too much information and I can talk about everything today, but I just have some flashcards to show you today what kind of information we had from the perinatal period and at 7 months, because as I said, it's huge. We have educational information, we have information about living conditions, level of education of the mothers and parents. So I can talk about everything today, but as I said, I will just show you some of the results. For example, the neonatal mortality rate according to birth weight. One of the important results in the perinatal period in 1973 was, of course, babies with low birth weight, of course, had a higher neonatal mortality rate than the rest of the babies. As you can see here, if the weight of the baby is lower, of course, the neonatal mortality rate was higher. 7.8% of the newborn in this study had less than 2,500 grams, and the percent of newborn in the group between 3,000 to 340.99 grams was the average weight was around 3,108 grams. So infant mortality in the group with birth weight, so low birth weight, was 6 times more than the average neonatal mortality rate and 12 times more than the mortality in the group with 2,500 grams. The main causes of death in the perinatal results at that time were congenital malformation, hyaline membrane, and anoxia. I mean, some of these results for you are, similar to the international literature. Of course, pregnancies less than 36 weeks, of course, the mortality rate is higher. Low birth weight had higher mortality rate. This is the same in the international literature. But the most exciting thing about these perinatal results is that we can analyze now all of these and correlate this information that we already have with the information that we will get from the adulthood period. For example, in terms of mother's age, the same. Gestational age less than 37 weeks and women with less than 19 years old, of course, the neonatal mortality rate was higher. 10% of preterm gestation correspond with mothers less than 19 years old. In preterm gestation, the neonatal mortality was higher in mothers with more than 40 years old. And in preterm gestation, of course, the neonatal mortality was higher as well. This is, I just put everything in tables just to emphasize these results. These results are, as I said before, similar to the results that you can find in the international literature, but will be even more interesting when we can analyze what happened with these babies, low birth weight babies, and how is the situation of health of these adults right now, 50 years after. This is the question that is, that is amazing for us, and how we can explain the situation of health of this population, taking into account all of these results. The other thing that we can mention about the perinatal results was, birth weight, as I said, and mortality rate. In the last slide, I comment, less than 19 years old, the mortality rate was higher in preterm babies and babies with birth weight low, and the same with the women were more than 40 years old. The perinatal mortality in the group with less than 2,500 grams, look at this result, was 14 times higher than the group of more than 2,500 grams. So it's really interesting that, the mortality rate is really high when the baby is low birth weight. At the same time, different problems of health can appear and can show up on all of this population of babies who were born with a low birth weight. one of the risks and one of the diseases that can appear and can show up in the adulthood is, as you can imagine, cardiovascular diseases, diabetes, even some diseases related to obesity and lipid profile. So this is really interesting for us. Here is the same, perinatal mortality. The highest percent of low birth weight correspond to female, not to male, was to female, 9.4%. And the total mortality rate was higher in males than females. The risk of die was 1.4 higher in males than females. These were some results related to sex. And also, the other thing that I want to mention in the perinatal results was the perinatal mortality according to number of previous deliveries. In this slide, you can see that we have more risk when the women had different deliveries, 4 or more deliveries than primiparas. So the percent of low birth weight was lower in the primiparas group. The higher perinatal mortality rate was in women with 4 or more deliveries, and the risk of the newborn to die increased with the number of deliveries. Of course, in Cuba, and I didn't mention these results here, but we have different projects, and in the projects, the results that always show up in terms of women mortality and pregnancy, during pregnancy, is, preeclampsia, hemorrhage, and of course, when the woman is primipara, these kind of diseases can show up. But if you have different deliveries, different pregnancies, more than 4 deliveries, so you are more at risk to have more complications. So this is something that they have these results even from 1973, which is amazing for us to analyze all of these. Right now we are now in 2021, and we can look back and analyze all of these results and compare with the results that we have right now from the health system in Cuba. The other thing that they analyzed was the level of education of mothers and fathers. For example, if you analyze the level of education of mothers, you can realize that the birth weight and the low level of education was related to perinatal mortality, a high perinatal mortality as well. So, of course, the level of education influences the way that the mothers take care of their babies. So quickly, I will just show some results about 7 months cohort. So at 7 months, they analyze different things: breastfeeding, nutrition, morbidity, medical consultations, immunizations. And for example, it's unbelievable because we have the same results in different projects that we have in Cuba around breastfeeding. At the beginning, when they just are in the hospital, most of the mothers are breastfeeding their babies, but after the time goes by, they abandon breastfeeding. So happened the same thing in this study. At the beginning, from 1 to 7 days, the higher percent of mothers were breastfeeding the babies, and after they just abandon the breastfeeding. And this is really important because the correlation between the breastfeeding and the chronic diseases is important as well, and it's something that we are interested in, and it's something that we want to analyze. When we analyze the causes of the discontinuation of breastfeeding, is the same that the results that we have from different projects. Insufficient milk supply is one of the most important reasons, and because the baby is hungry, is crying. The other reason that we didn't find in this study, but we found in other studies that we are analyzing in Cuba, is the growth and development of the babies. If the mom don't see that their babies are growing well, so they discontinue the breastfeeding. And for us, this is really important because one of the goals of the Ministry of Health is to increase the rate of exclusive breastfeeding in Cuba. So the other results, again, is the mother level of education and the way that they are incorporating the nutrition to the babies. For example, mothers with a higher level of education, they try to introduce food according to the according to the diet and according to the recommendation from the pediatricians. And the nutrition is more varied, but the mothers with low level of education didn't introduce the variety of food like veggies, proteins, and on the other hand, they introduce a lot of carbohydrates. So again, the level of education influenced the way that the mothers are giving nutrition to their babies, and of course, affecting their health and affecting their development later on. Other important result was the infant mortality rate according to birth weight, and the survivors at 7 months was the same. At 7 months, babies with low birth weight had more health problems and more infant mortality rate. I mean, the infant mortality rate was higher, even at 7 months. The same here, mortality rate according to the mother's level of education. If you analyze this, the percent of mothers with low level of education is, at least in this study in 1973, they correlate the level of education with the high mortality rate in mothers with low level of education. If they analyze the sex, we analyze the sex, was higher in males than females. The other point that I want to, as I said before, there are tons of results that I can explain in this presentation. I just choose some of them, like, birth weight, level of education of the mothers, breastfeeding. Another important point, I think, that is infectious diseases. For example, in this study, they realized that infectious diseases, diarrhea, and also respiratory diseases were higher in babies that never received breastfeeding, and was less than in babies who receive breastfeeding. And the admissions to the hospital, if you can see here, was less. I mean, if the babies receive breastfeeding, exclusive breastfeeding, or if the babies receive exclusive breastfeeding, or at least mixed breastfeeding, they will have less probability to have infections, diarrhea, less number of consultations, and less admissions in the hospitals, which is important for Cuba because we have a social health system, and we also try to target, and try to do promotion and prevention of health with the objective, the goal to reduce the admissions in the hospitals, try to do the promotion and the prevention before the treatment. So breastfeeding is really important for all of us, and these studies show up the same results. For us, will be really interesting to know what happened with these adults right now, 50 years after. Acute diarrhea, again, they correlate acute diarrhea to birth weight and the admission in the hospital. So low birth weight babies show more infections, more consultations, and more admissions in the hospital. So it's important to target low birth weight babies to know why we have the low birth weight babies and what happened with them, and follow them during childhood, because this is important to prevent chronic diseases in adulthood. So as conclusions, we have the mortality rate for the period from 7 days to 7 months was higher depending on whether the child was born with a lower weight at birth, male, resident in the east of the country, or the mother had low level of education. About half of the children abandoned breastfeeding around 3 months. Is the same that the results that we have in other studies that we were doing. And a third part of them continue breastfeeding until 7 months of age. The main causes of, abandon of breastfeeding was insufficient milk supply and a hungry crying baby. The high consumption of carbohydrate during the lactation period was higher if the mothers had low level of educations. Males and low birth weight babies show a higher mortality rate between 7 days and 7 months, more infectious diseases, and more admissions in the hospitals. And the low mother's level of education was related to higher perinatal mortality rate, was a worse nutrition, more attendance to the consultations, less attendance to the regular consultations with the pediatricians and family physicians, and of course, more admissions in the hospitals. So as I said before, we have a lot of information that I can discuss, but the other important thing that they analyzed was the living conditions. And as you know, because in Latin America, living conditions are so important, they divide in different categories the living conditions, and they applied questionnaires to the parents, and they did reading tests and math tests. And of course, they realized and they had results with a correlation of poor living conditions and poor performance in the school. And of course, all of this is related to low level of education of the mothers. So it's something that for sure you know, and you have this result from other studies, but for us, it's important to have all of this information in a database and look and analyze what happened with these adults right now. They are working, how they are the economic social conditions right now of this population, how is the health of this population as adults. For us, it's really interesting. So better living conditions were related to better school performance, better intellectual development, more neurological maturity. High mother's level of education was related with better school performance. The other important thing that they found, children from urban areas had better growth than rural areas. And in terms of race, they found some difference between the Black children and show higher stature at the beginning and after this change. So this was the same. Related to the mothers, mother's height was the variable with more influence in the height of the children in both sexes, and living conditions was the second variable, and birth weight was the third variable with more influence in the height of the children in both sexes. Because after they followed these kids, as I said, 7 years, 11 years, 17 years, and they were analyzing BMI, of course, the weight, the height, and all of the nutritional characteristics of all of this population. Marcos is too much. I just want to conclude that Cuba is one of the few countries in the Western Hemisphere with reliable population-wide growth reference, despite many years of economical hardship. That this study results demonstrate positive changes in Cuban children and adolescents, physical development. Also, they show a positive secular trend in height. I think that the most important thing in this study is that we can have all of this information and we can insert different projects to know more about the characteristics of the Cuban population from pregnancy to adulthood. And also we can find different regional differences between social demographic groups that have to be confirmed with more comprehensive studies, including a broad set of health, economic, and social variables, and that should be addressed through strategies to benefit the most vulnerable population. Which means that this will benefit not just all the scientific community, but also we will benefit all the Ministry of Health, because Cuba, one of the most important things is that all of these research projects is evidence that we have to set up strategies, programs at the national level to address all of these chronic diseases. So it's very important for us to analyze the socioeconomic trajectories from birth to adolescence and risk factors for non-communicable diseases, the life course association of maternal smoking during pregnancy and offspring health, socioeconomic changes in adolescence psychopathologies, incidence of school failure according to baseline leisure time physical activity practice, predictors of body mass index from birth to 17 years of age, and a lot of other goals that we have with this study. We want to include, of course, different teams. In the past, we include different teams in the research project that we have. This is Steve Lai. He is my boss from Canada. In these pictures, you will see part of our team in Cuba from the National Child and Growth and Human Development Group. So the strategy with this study is to have all of these results that we have, and I try to quickly summarize, but as I said, it's too much, from birth to 17 years, and try to find this adulthood, and this adult population will show all of these, socioeconomical and health situation that for us will be really important to correlate and analyze. Also, we want to include the Genetic Institute because we want to know more about the genetic factors and the environment. So in this study, as I said, the scope will be interinstitutional. Also, we will have some researchers from the neuroscience field. And all of us, we can think in different projects and we can insert these projects in the database that we will have at the end of this study. So here is just an example of another project that we have in Havana, in Cienfuegos. The collaboration is huge, and we want to invite all the Latin American researchers to be part of this, project as well. Not just this one, but other projects that we can think and we can do together in the future. Because in Cuba, there are a lot of things to do. Cuba, the Ministry of Health, is really focused on understand more the chronic diseases to address all of these factors and create a strategy and intervention strategies and at the national level, not just in one province or in one municipality. This is the most interesting part in Cuba, and the most interesting thing in Cuba, that everything that we can find is if we have the scientific evidence, we can target and we can do strategies to apply at the national level. This is another picture for the from the Maternal Child Health Symposium. This was celebrated in 2019. Unfortunately, we had to cancel the 2020 symposium, but for sure in the future we can have more, and of course we can invite all of you. So thank you so much, and I am open to different questions. I hope you understood my English with a Latin accent, and please, Marco, I am just giving the space for you.
Okay. Thank you so much, Vera, for your nice presentation. It's important to mention here, and I'd like, first of all, mention here and say thank you to Dr. Stephen Matthew from DOHaD, Canada, who put me in contact, or who put us in contact with Dr. Vera 2 months ago. So it has been very important for us, this contact. Okay, so Vera, now we can open for questions. We have one inscription by Professor Paulo Matias, and I'd like to tell you that unfortunately in this platform we don't have a chat. So if you want to make a question, please use the little hand in the bottom of the screen, so you can give you the word in accordance to your request. So please, Professor Paulo Matias, make your question.
Okay, Vera, thank you very much for your presentation. I myself delighted with you talk to us. Most of your data, it's confirmed or supported by international evidence, international means. A lot of countries have the same data, mostly indicated that low birth weight is a damn thing to the children, to the parents, and then to them when they turn into adult life. Most you presented no communicated disease. So, Vera, I wanted to know many things about Cuba, about your study. But before, I have to say that 5-6 years ago, we tried to make some contact with Cuba, because we have a massive importation of physicians to Brazil, the Cuban that work with the family medicine. So this man and woman that went to Brazil to work, for example, very, very far in the Amazon forests, or most of them work in the periphery of the big cities in Brazil. So we try to contact, but unfortunately, you don't have any answer. And after 2016, the government of Brazil, the government that do not work to the people in Brazil, to the workers in Brazil, destroy everything that we built during the last, let's say, 2 decades or 1 decade with our government from the President Lula, that I think that you know, and our president, women, Dilma Rousseff. So I talk about this because you know, is a trajectory that we could be with Cuba to help us to apply to execute some policies in public health to try to help our children, to help our young, to help our adult people. So unfortunately, everything was destroyed. You try to rebuild it now, but unfortunately, we have a pandemic that you know, that the deviation, our attention, our let's see, the combat against the fascist government in Brazil. So I think that your cohort started to 1973. So in 1973, Cuba was supported, at least a part, from Soviet Union. But in the late 1980 years, the Soviet Union was destroyed by the Occidental Alliance, including the United States, shifting that. So, and then after I believe that social and economic conditions in Cuba changes a lot. Was a proof that Cuban could be survived and with the revolution after this crisis. But I think that was some reflex. But I think that was some reflex in this cohort. But I can see nothing in your presentation. And also, we know that the injuries in the early life can induce diseases in the adult life. But also, you know that some processes or some therapeutics, for example, the physical exercise, because Cuba is very strong to their teenagers. They, you know, you offer a lot of export, etc., etc. And then this can be changed the fate of the little one that was born with the low birth weight, and then he has support from the public health, support, for example, doing physical exercise can be changed the trajectory of these babies. And also, you know, here in Brazil, another many countries in Latin America, the breastfeeding is not supported by the exclusive breastfeeding, not supported by the government, by the capitalism, because the mother can go to work, or the boss not allow the ladies stay breastfeeding their babies for more than one month or 2 months or no month at all. So how Cuba handle with this? And one thing that you say, that the best nutrition during this period is very important. Cuba support, for example, the diet of these ladies, this mother, or it's we assume that in Cuba you have plenty condition of better nutrition to the mother during this period. I'm sorry, Vera. I'm sorry, my colleagues, because I am very curious. I waited this day for years to hear colleagues from Cuba. And also, to finish, I wanted that you, if possible, you send me your contact, email, or your WhatsApp, because I have other questions to you. Thank you.
Thank you so much, Paulo, and thank you so much. And I will try to answer all the questions that you did. As I said before, this is a huge study. We are trying to get all of this data into a database to explain more. 50 years of follow-up, because this started in 1973, and now we are trying to get this adult population and know what happened to them. So, for example, in terms of all of your questions, first question, I just mentioned some topics like, anthropometric measurements, breastfeeding, nutrition, but of course, there are plenty of other variables that I didn't mention in my presentation, but we have this information. Cuba had different critical periods. One of the critical periods that you mentioned was in the 90s. We have some information from this period of time when the socialist countries disappeared. So Cuba had a period of starvation, but the National Growth and Human Development Group had different results, analyzing the height and the weight of the babies and children at that time. Part of this information, we have it in this study, but it's not just focused on that period of time. It's just follow these babies from 1973 to 17 years. And after, of course, now, during adulthood. But of course, we are really interested, in to know more about what happened with the nutrition of these adolescents now during adulthood. In terms of nutrition, even in the 1970s, Cuba always prioritized, as I said, the primary health system. And the Mother Infant Program is one of the most important programs that Cuba has in the Ministry of Health. The Mother Infant Program is, focused on the health of, mothers during preconception, pregnancy, and after when the baby is born. And when we analyze and we find, for example, women that need support in the communities, we have different initiatives as part of, this Mother Infant Program. For example, we have mothers' houses. If the mothers have, for example, difficult socioeconomical conditions, they can receive help, not just from the Ministry of Health, but different ministries like agriculture. They receive special nutrition, etc. Of course, always Cuba, in all of these past years, we had a difficult economical and political situation. But one of the goals of the Ministry of Health always is prioritize the health and nutrition of the pregnant women. Not always is 100% perfect. The system is not perfect. The health system is not perfect, but we are trying our best to have at least good nutrition and of this population. And also after the baby is born, of course, family physicians are following these babies with regular consultations in the polyclinics and in the family physician offices. And it's something that Cuba tried to do in Venezuela, Ecuador, Brazil, when the physicians are working in this community and these areas that you were mentioned. Brazil was an example, was trying to set up the same system, the primary health system, which is based on in the communities, trying to prioritize the vulnerable people, like old people, people with chronic diseases, and mainly mother infant health, and trying to reduce the infant mortality and the most common diseases among children, like infectious diseases. So this study is huge. We will analyze different things, but one of the questions, yes, family physicians from Cuba are really well prepared, and they were working in different countries in Latin America. The second thing, Cuba prioritized the mother-infant health with the follow-up in the polyclinics with the family physicians, and also with nutrition and help when the mothers needs help. And this study is just another, huge study that will allow us to analyze more the information that we have in different communities, and how is the development of these chronic diseases. Breastfeeding is something that is really important for Cuba, because in the last years, UNICEF was working with the Mother Infant Program, the Well Child Being Society and group, Pediatric Society, the National Growth and Human Development, trying to increase trying to increase the rate of exclusive breastfeeding, because in Cuba, the rate of exclusive breastfeeding is lower than 50%, so lower than 50%, even though Cuba has maternity leave of 1 year, and all of this support, the breastfeeding is still low. And we want to, increase this rate, and of course, give more information, more advice, and trying to do more intervention to the families to improve the nutrition of these children to prevent chronic diseases. In Cuba, chronic diseases is a problem, because the main causes of death in Cuba are not infectious diseases. The main causes of death in Cuba are chronic diseases, cardiometabolic diseases, malignant tumors, etc. So there are a lot of things to do. And of course, Paulo, I will give you more information about Cuba, about our projects, our data. There are plenty of things to, discuss.
For sure, Vera. We can put you in touch with Professor Paulo Matias for further discussion on this very interesting topics. With no doubt, having a 50-year cohort is a very important point for DOHaD research in Latin America. So now I give the word to Dr. Henrique Abeixa. Please, Henrique, go ahead. And just to remind you, if you want to ask in Spanish or Portuguese, as you prefer, it's not an obligation to speak in English during the questions and answers. Please. Henrique?
I'm sorry. Thank you very much for your dissertation. I haven't seen any data on cesarean section rate, and I presume it's very low. Otherwise, I would like to know what is the rate on cesarean section. And the other question is, do you measure anything on microbiota? Because it is associated with obesity also. Thank you.
Thank you so much for your questions. I think that there are interesting points. I know microbiota is really important. At that time in 1973, unfortunately, we don't have this information from that period of time. Remember that this was, a follow-up cohort from 1973. So we have a lot of information, but not this kind of information about microbiota. We are planning to do different research projects, and we will take into account this important info. But we have right now the cesarean section in Cuba over the years has been increasing. I can send you the percents that we have right now. At that time in 1973, I don't have the data right now, but was lower than now. Of course, C-section in Cuba is higher than years before. In comparison, for example, with Canada and US, it's still lower. And we don't have, so we don't use any painkillers during delivery. I mean, not anesthesia, not the delivery is really physiologic delivery. But with the pressure that the physicians and the health system, have with the infant mortality rate and reduce the infant mortality rate, I think that the C-section has been increasing in the last years. I can send you more information about this data, the data that we have right now, and the data from this study in 1973. But it's something that we have, because in the information that we collect, we have a number of delivery and all of this information around the delivery, the perinatal period, what happened at the hospital at that time. I think that is really important what you mentioned. And Marcos, I just want to open the discussion and I can share information about this study as soon as we have more data analyzed with different researchers from Latin America, because as you can see, we have tons of fields. For example, mental health, nutrition, toxic habits. I mean, if some researchers are interested in collaborate with us in different projects, we can insert these research projects as soon as we advance in this project. Also, I want to mention, Marcos, before I answer any other question, that this project is in collaboration with different other researchers. They are part of this webinar today. And one of these is Mercedes Esquivel. She is the leader of the National Growth and Human Development Group. Also, I want to mention Gisela Alvarez. She is the head of the Wellbeing National Group in Cuba. Dr. Emilio Buchaca Faxas, he will be the president of the Cuban DOHaD group. I think that all of them are connected, if I am not wrong. And Jordanka Morgado will be the person in charge of the basic biological science, because we want to include biochemical studies and genetic studies as well. Just for information, they can contact me, Marcos. You can share my email address, and I can be in contact with anybody who is interested in different topics.
Great, great. Yes, if you allow us, we will share your email with all those are interested in entering in contact with you. Okay, Vera? So now, for next question, Dr. Egberto Gaspar de Moura from Rio de Janeiro in Brazil. Please, Egberto, go ahead.
Okay, thank you, Dr. Vera, for this wonderful presentation. I became fascinated by your data. I work with breastfeeding and smoking in experimental studies. And so I'm very interested about the association between breastfeeding and obesity. And so I want that you talk a little bit more about which age the children start to develop higher body weight gain, if you have already this data, and if there are some interaction between the mother that smoke and the lower period of breastfeeding. If you already has this kind of data, and also the interaction between smoking, the lower breastfeeding, and association with chronic diseases like obesity, diabetes, or whatever that you have studied in this wonderful study. Congratulations.
Thank you so much, Alberto. And I think that you can collaborate with us in these topics. We have, beside this study, we have 2 more studies around breastfeeding in collaboration with Canada, with Cindy Lee Dennis at the University of Toronto. Cindy Lee Dennis. I don't know if you are familiar with her work, but she was, giving us expertise and help with different projects. For example, one of them, we were analyzing breastfeeding, and exclusive breastfeeding. And one of the things that we analyzed is the relationship with the smoking habits. And we didn't find any, but in that study, we just include Havana. It was not this study that I am mentioning today. So in this study, we can analyze this because, as I said, we have tons of information. We are in the process to introduce all of this in a database, and we have a lot of things that we didn't analyze yet. So we can include this analysis now in this study, and trying to correlate this with the BMI and the anthropometric measurements of the children, because we have this information. And the most important thing is the impact on all of this in adulthood, because now we will have the adult population, and we can correlate if this breastfeeding and this obesity during childhood or overweight, whatever we found, is correlated with cardiometabolic diseases in adult life. I think that this will be a very interesting project. And if you want to collaborate with us, you are more than welcome. So I think that we can, in the future, to be in contact with Mercedes. Mercedes, as I said, is the leader of the National Growth and Human Development Group. And we have information and data about obesity in children. We are really worried because this is something that is increasing over the years. Around 7-8 years, we realize that children are gaining more weight. And there are different reasons and different causes that we found. One of them is, we have low rate of exclusive breastfeeding, as I said. We had social and cultural elements that, help this behavior. In Cuba, we have a lot of food. I will not say food instability. Like, for example, right now we are in an economical crisis after, Trump government, the embargo, and plus the pandemic. So the diet is based of a lot of carbohydrates and less physical activity. So in the past years, we realized that, children were gaining more weight, and obesity in children is increasing in the last years. So this is something that we have more details that we can send it to you. But of course, it's something that is, is a preoccupation for the national authorities, the Ministry of Health, and it's something that we have to address, because this obesity during childhood is the reason that, they continue overweight or they continue with this obesity. And as adults, they have a lot of chronic diseases that, we have to manage. So high lipid profile, high levels of glucose, obesity, the behavior, less physical activity. In Cuba, we didn't have internet before, but now it's something that is extended all over the country. And this behavior, kids were playing outside all the time.
Games.
Now they spend more time inside homes. Not just because of the pandemic, but even before the pandemic, we had this situation as well. So it's something that is that we want to explore as a researcher and as a cardiologist. I think that, I was focused more in treatments and trying to, solve the disease. But if you analyze as a physician, as a researcher, what is my best approach to this problem, is trying to find why and how I can prevent that this happen. And what is going on in Cuba, probably similar to the situation of different countries, but in Cuba, I think that the benefit is that if we have, evidence based on science, we can do interventions and we can extend these intervention programs in communities, in provinces, and at the national level. So this will help a lot of people.
Vera, a quick question. Is smoking in Cuba, is the prevalence is falling down or is increasing? Because in Brazil,
increasing.
In Brazil,
smoke
falling in the men, but is increasing in women. And then
and we don't have any law, because in Canada, for example, you know that there are a lot of restrictions of smoking. You cannot smoke in public spaces, not in restaurants. Canada has a lot of restrictions in terms of smoking in public spaces. In Cuba, we don't have any prohibition in this sense, any law to protect the rest of the population who are not smokers. So it's increasing.
Okay, thank you very much.
Okay, thank you, Egberto. So our last question by Dr. Carlos Grande. Please, Carlos, go ahead. Carlos?
Sorry.
Okay, go.
You hear me? You hear me? Yes. You hear me?
Yes.
Okay. Very nice, your presentation. And I have a question. Less than 2,500 is a grams adverse. It's a very hard data that leaves gestational age aside. I think better to analyze the data using phenotypes, new phenotypes at birth, according to sex and gestational age. For example, small for gestational age, large for gestational age, stunting and wasting, according with Intergrowth 21 standard, which is currently used for international comparison. I think this information will be more enriching for the study.
Thank you so much. Is Ramon?
Thank you.
Thank you so much for your comment. And as I said before, please be in contact with us, because all the feedback and and ideas that you have about this project, we can we are more than open to discuss with you. And as I said, this just is a small part of this huge study, and we have plenty of others data and variables that we need to analyze. And of course, you can, Marcos, I think that this is an excellent opportunity for different researchers to be in contact with all researchers in Latin America. As part of this team in Cuba, we will have people from genetics, people from neuroscience as well. So neonatologists, pediatricians, so we can show different topics, different data, different fields. And please, we are more than welcome to accept all the feedback that you have for us in terms of analysis and ideas.
Good. One important point about this wonderful presentation by Dr. Yeneir Vera, all of us have seen right now, is that they are really interested in collaborating with all of us in Latin America for many reasons, to strengthen the relationship between DOHaD researchers in Latin America, and of course Cuba is included, but also because as all of us are aware, these decades of embargo have put a lot of difficulties to Cuban researchers in analyzing data, in have access to equipment, to facilities, and a lot of other things, including publication in good journals. So it's very important to be attended to the fact that they are fun on sharing this data in terms of scientific collaboration with all of us. And to us in the Latin American DOHaD chapter, will be a pleasure to put all of you in contact with this wonderful DOHaD group in Cuba to strengthen these collaborations and researchers for the short future. With no doubt, having as I said before, having a 50-year cohort is a very, very, very important tool to understand the developmental origins of health and disease, in particular because it is our reality. The reality, the socioeconomic reality in Cuba is not different for the socioeconomic reality in Chile, in Argentina, in Brazil, in other countries of Central America. It's a very, very important thing. So unfortunately, we have to finish this presentation, this webinar. We're 10 minutes more than the predicted time. But once more, in the name, on behalf of all of us Latin American researchers on DOHaD field, I'd like to say welcome. I'd like to welcome all of you researchers from Cuba. You can count on us, and you really want to count on you. Okay, thank you to all of us for being with us. And so, Vera, I let you the last words to finish this presentation. Please, your last message.
Thank you so much to all of you, and it's a pleasure for the Cuban researchers and physicians to be part of, Latin American DOHaD chapter. You are more than welcome to collaborate with Cuba. As you said, Marcos, Cuba was, because of the embargo and different reasons, Cuba is doing a lot, but we don't have a lot of international publications and even publications in Latin America. I think that most of the work that Cuba is doing in terms of research is not published. So you are more than welcome to collaborate with us, and we will be more than happy to publish with all of you and collaborate with you. Also, of course, we will be in contact, and we will invite you to the next symposium, the Modern Child Health Symposium, if we can, celebrate the symposium next year. But please share my email. I will put in contact all the researchers with different researchers in Cuba, and collaborations can, start. Thank you so much. Thank you.
Okay. Okay, so in 1 month, on May 19th, we have our next webinar when we'll have the pleasure to listen to Dr. Elena Zambrano from Mexico with one more nice of your presentation. So be fine, be well. Thank you for attending, and we see all of you in 1 month. Thank you. Good afternoon.
Thank you so much. Thank you.
Thank you very much, Yeneir. I have some questions to you. I will send you by email.
Okay.
Thank you so much. Bye-bye.
Bye-bye.
Ciao, ciao.
Bye. Bye.
Take care, everyone.
Bye.